now we can move on to the introduction of the 5 most commonly used tools for tracking health expenditure. So I'm going to go over this table just to orient you to them. Given our limited time today, this is going to be a pretty general overview of these tools. Later on in the webinar, we'll tell you about a new guide that HFG has developed that has a lot more detail and that you'll be able to access after this webinar. So you'll see in this table 5 tools. The 3 at the top are for tracking general health spending, and the bottom 2 are disease-specific. The first tool mentioned in this table is the Public Expenditure Review for Health. The scope of this tool is publicly managed expenditures and financing flows, and the purpose of this tool is to evaluate government spending against predefined parameters of, for example, efficiency or effectiveness or equity. The next tool is the PETS, or the Public Expenditure Tracking Survey, which again tracks publicly managed expenditures from the central level to service providers, and the purpose of this one is a little different in that it assesses effectiveness of service delivery from publicly managed funds, and it identifies sources of leakages and bottlenecks. The third is SHA 2011, often referred to as health accounts. The scope of the health accounts tool is all health expenditure, and it tracks total health system spending from all sources, including public, private, and donor spending, and can also present data disaggregated by disease. The bottom 2 on this table are the disease-specific tools. The JRF is for immunization expenditure. The JRF is a reporting form, and one section of this form focuses on indicators specific to immunization financing. The last tool is the NASA, or the National AIDS Spending Assessment. The scope of this is HIV/AIDS expenditure. An interesting feature of NASA is that it tracks not only health expenditure, but also non-health expenditure related to the HIV/AIDS response. So before I move to the next tool, you may want to just pay attention to the acronyms here, the PER, PETS, HA, JRF, and NASA, which you're going to see on the next slide and in the rest of the webinar. So this Venn diagram includes all 5 tools and gives you a sense of how they're related to one another. The first thing you might want to pay attention to in this diagram are the boxes with the blue outline, in which you'll see the 5 tools that we just mentioned on the previous slide. The boxes with the red dotted outline are showing the different types of health funds. So what you'll notice is the outer circle represents all direct health spending, and the inner circle in this diagram is government spending specifically. So that's why you'll see the PER and the PETS are in the inner circle, because they track publicly managed funds or government spending. And the health accounts methodology you'll see is in the outer circle because it encompasses not only the government spending, but also private and donor spending. Another interesting thing to notice in this diagram is the NASA, which is a wedge of all health spending because it's disease-specific, but you'll notice that that wedge extends outside of the outer circle because NASA includes non-health spending in addition to direct health spending. Now that you have a basic understanding or introduction to the different tools, let's talk about the considerations that go into choosing the right tool or tools for your country. So this slide presents some questions that you might want to ask yourself when you're thinking about which tool makes sense in your country's context. You may want to consider what question you're trying to answer with health expenditure data. Are your questions related to policy and planning, for example, understanding whether expenditure is in line with priority health areas, or are you concerned about efficiency of a program, or perhaps HIV and AIDS spending in particular? You may also want to ask yourself what health expenditure data is actually available in your country, and what might be easily available or readily available, and to what level of detail, or what data might need to be collected for a particular tool. You may also want to think about whether there are financial or time constraints to consider, in terms of which tool makes sense. You may want to think about which data need to be ready for a particular budget cycle, whether there are resources available to implement the exercise. And lastly, you would want to consider the benefits and risks of using more than one tool at the same time, and you may want to understand more about which tools complement each other or whether there's actually overlap between different tools. So before we move to our interviews of the panelists, I think it'll be interesting to all of us to find out which of this list of factors has been the most critical in determining the choice of expenditure tracking tools in your country. So again, we're going to do another quick poll. You should see a pop-up on the right-hand side of your screen. Please select which factor has been most critical in making the choice of tracking tool in your country, and don't forget to scroll down and click Submit. So the results of our poll are in. It's great to see that of the audience members who responded, the majority actually chose government and policy priority as the factor that determines the choice of expenditure tracking tool. This is the ideal reason for choosing a tracking tool, so it's great to see. We also see a few of our participants selected donor request and data availability as their responses. So in order to get some insight into which of these factors has influenced the choice of tool in countries, let's turn to our panelists. Let me introduce our first panelist, Thomas Mbeeli. Thomas serves as Deputy Director of Planning for Namibia's Ministry of Health and Social Services. He has over 13 years of experience leading resource tracking activities using a variety of tools. In his current role, Thomas is responsible for developing medium and long-term plans inclusive of health financing for the health sector, and he also helps generate evidence for policy decisions and strategic planning. Thomas, thank you for joining us today and welcome. Could you please start by telling us which resource tracking tools have been implemented in Namibia and what factors led to choosing these tools?
Good morning or good afternoon, and thanks for having me as a panelist. As a country, we have been implementing the health accounts as well as the National Aid Spending Assessment. The National Aid Spending Assessment, we have only done it for 1 year, and we are currently busy implementing it in our second year. But generally, we have been implementing the system of health accounts. Now, the factors of choice were mainly 3 items: policy priority, the reporting needs to UNGAS as well as to World Health Organization, and our comparability across countries with regard to health spending. Now, when it comes to policy priority for Namibia, we really need to understand the overall resource flow to the health sector, and to understand that the resource flow, is it in line with our priority areas of the health sector policy framework, which are namely HIV, AIDS, TB, malaria, non-communicable diseases, and maternal health. And over the last couple of years, we have also tried to understand the sustainability of financing in face of declining donor support, which has drastically declined from 23% to around 9% as per our last National Health Accounts of 2014-15. Now, with regard to reporting, we really need to inform our partners where we are in terms of sustainability and health expenditures, as well as to compare ourselves with other countries where we stand in terms of our health expenditures. Thank you.
Thanks, Thomas. Could you tell us whether there were specific challenges you faced with the selected tools?
Yes, within the Namibian context, we had one particularly is coordination of the production of the resource tracking exercises, be it the system of health, the National Health Accounts, which is done by the Directorate of Policy Planning in the Ministry of Health and Social Services. Then we have the NASA, the spending assessment, which is done by the Directorate of Special Programs for HIV, TB, and malaria. Therefore, we had two coordinating units within the same ministry trying to do one or similar resource tracking exercises. The outcomes of our findings usually came to that we had contradicting results in terms of what was the overall resource envelope for HIV, which is aligned to the health sector. As well, we did not look at what the issues on non-sector. Secondly, we are looking at technical capacities, is that we have had quite a high turnover of personnel within country, within the ministry, in terms of production of resource tracking exercises on an annual basis, as well as the technical capacity in understanding the methodologies to use. Data availability has become a main concern as well, in that we will have to do proper mapping of all possible stakeholders, your donors, your NGOs, civil societies, as well as government ministries, which are really related to spending on health, as well as spending to HIV/AIDS matters. Then lastly is the issue of government and donor priorities, because government is looking in terms of overall resource flow, while our development partners are looking at sustainability. I think those were the main issues or factors, challenges in implementation of the tools.
Thanks, Thomas. So given the challenges that you faced, could you tell us which tools you've chosen to implement moving forward and how your experiences informed those choices?
Thank you. I think the lessons from all our exercises has made us that we agree to do regular health accounts and NASA together, a combination. Why is it so? It's now much easier to analyze the health accounts data because of the hub tool which is available. Obviously, the only aspect is the data collection, which still remains a serious challenge. But once you have done your data collection, analysis is much easier. Harmonization of the two exercises, the health accounts and the aid spending assessment, it really reduces duplication of efforts, in that you have one ministry or one overall lead coordination, and we are going to the same respondents. Therefore, they will not be able to respond on two different questionnaires. And you have also limited capacity in terms of numbers of persons to be able to do the data collection as well as follow-ups to questions. The other important issue is that the NASA and HIV subcategories or expenditure categories requires quite substantial data. Therefore, the methods, your data collection tools for health accounts need to be adopted so that we can dig further deeper into the expenditure categories and data for HIV and AIDS. But this tool should be harmonized. If we have a more harmonized tool for NASA and SHA, you will not have contradictory results, and we as a country will be providing one expenditure detail for health expenditure as a country without any contradiction. Thank you for.
Thanks, Thomas. It sounds like now that you've decided to implement both the health accounts and NASA, your work to harmonize the two is quite exciting and will also be helpful to other countries in similar situations. As a reminder to our audience, if you have questions for Thomas, please feel free to submit them in the Q&A window now. You'll also have an opportunity to do so later on. Let's turn to our next panelist. Dr. Gemma Nemeth. Gemini is the finance team lead for USAID's Public Sector Systems Strengthening Project in Tanzania. He has more than 10 years of research experience in the areas of healthcare financing and social protection. In his current role, Gemini coordinates implementation of interventions that aim to improve public financing systems, including improving provider payment systems, budgeting, planning and procurement, and financial management. Gemini, thank you for joining us today and welcome. I'm going to start with the first question. Could you please start by telling us which resource tracking tools have been implemented in Tanzania and what factors led to choosing these?
Okay, thank you, Shipra, and hello, everybody. In Tanzania, we have been implementing the public expenditure review. We are doing the national health account, the NASA, but also we have done PAIDS at some time. And the factors that have led to the choice of these methodologies include, first is the government needs. And this is mainly the need to inform the planning and budget cycle. So each year, the Minister of Health has to submit its budget to the Minister of Finance, and it has to do a couple of negotiations. So they need the information that shows how the budget performance was for the previous year so that they can build on that during the negotiation processes. The other factor is the data availability. Here, the public expenditure review is mainly using the data that is coming through the central government system, the Ministry of Finance and the local government authorities. So it's easy to do that quickly because you just extract the data from those systems compared to conducting the national health accounts and the NASA that you need to take more time to collect data and do the analysis. So in this case, you find PRA is quickly being done in Tanzania compared to other methodologies. The other factor is the donor needs, and here we mainly refer to the needs to report to different programs. Like the PEPFAR has to know how much the spending has been in the system. The Global Fund will need to know how the spending to the priority diseases has been, and what is the complementary financing from the government across all these vertical programs. So this is the information that we need to get from National Health Accounts, and we have to do that to submit. And then the other factor is the continuous policy refinement that the government is doing. Like if you want to do a major financing reform, the data on how the composition of financing is going to be necessary, like how much burden is going to households so that you can prioritize government financing and health insurance in the country. Thank you. Okay, so on the side of the challenges, we have several of them. The first challenge that we are facing is on the side of data availability. And here, compared to national health accounts and the NASA, it's easy to get the public expenditure data because we just extract from the central government system. But it's very difficult to get a disaggregated data to do a good national health account or a good NASA. And in most cases, we are forced to use what the development partners are reporting as the money that they have disbursed, and we use that to map in the national health account, which is not appropriate. And the reason for this is because the implementing partners, include the donor, the NGOs, are not providing actual expenditure data. So sometimes you risk overestimating spending on the side of the donors. The other challenge is we are doing the parallel resource tracking methodologies. We have the PRA, we have the National Health Account, and the NASA. And unfortunately, the NASA is not being coordinated within the Ministry of Health. So sometimes these three methodologies have to be harmonized, and it's a process that is taking time. So if you have already published the public expenditure review, it's always a challenge to get back and refine, even if you get more improved data to do the national health account. So it's important to do the harmonization across all these three methods. The third challenge is more on the technical capacity within the Ministry of Health. We have very limited number of people who can do all these three methodologies at par. And for this reason, the Ministry of Health has to depend on the external support, especially from some of the academic institutions or consultancies, to be able to accomplish the demand to do the PR and also conduct the national health account. And lastly, is the government priority. In most cases, you find there is a budget line to undertake the public expenditure review. in the Ministry of Health budget, while it's rarely you find a good budget to do the National Health Account. So sometimes the National Health Accounts and the NASA, they are delayed to be conducted compared to PRR, because it seems like the public expenditure review is a priority to the Minister of Finance, of Health, to inform the budget negotiations. Thank you, Shipra.
Thanks, Gemini. So given these challenges that you just described to us with the various tools, can you tell us about which tools you've chosen to implement moving forward and how your experiences informed those choices?
Okay. So for currently the two methodologies, the public expenditure review and the National Health Accounts, are the priority. And occasionally we do the NASA. And the reason for choosing these tools is more on the first aspect. It's the experience on the feasibility of undertaking resource tracking. And feasibility here, we're talking about the data availability, the capacity within the people who are involved in doing the resource tracking, and the timelines that are imposed in conducting this resource tracking. So PRI is definitely the first priority for Tanzania, but there is also a push for the National Health Accounts to be conducted from year to year using the SHA. So since 2010, the SHA have been produced from year to year. And then the other lesson that we have learned so far is the issue of timeliness on producing this resource tracking. It's always taking time to do the National Health Account and the NASA. So although we have an urgent need of aligning the public expenditure review into the National Health Account, the problem is we still have to do it separately because of the time that is taking to do the National Health Account. So it's important to look at the line of demand for these products of the resource tracking so that we can align also our decision to produce them. And then the other aspect as a lesson moving forward is the issue of institutionalization of resource tracking in the country. As I mentioned, we have the challenge in technical capacity within the Ministry of Health. So good intervention for Tanzania, with the collaboration between the universities and the Ministry of Health, we have introduced the module, the health financing module, that includes the resource tracking in the universities. University of Dar es Salaam has already started this. We are currently in the process of introducing in other universities. So in this way, we are creating critical mass with this technical capacity so that I can also support the Ministry of Health and the government at large to frequently produce all this resource tracking data. And the last aspect, I think, as a good lesson is the alignment of our resource tracking approaches to the policy or government priorities. And for here, as the government is ongoing with refinement of the financing policy, we need good data for them to make a good informed decision. If we have a good resource tracking that is telling where the most chunk of financing is coming, then it will be a good basis to negotiate with government to come up with a policy that is giving priority to government funding, but also expansion of the insurance in the country. Thank you.
Thanks, Gemini. I'm glad we managed to connect. It's really great to hear about the institutionalization efforts that you're making with including a module in the university curriculum. And it's also interesting to hear that in Tanzania, the timing issue seems to be key in determining which tool or tools make sense. Karishma is going to give us a global perspective on choosing the appropriate tool to track health expenditure. Karishma serves as a resource tracking advisor for USAID's Health Finance and Governance Project. She has over 11 years of experience in health financing in international development with expertise in resource tracking, performance-based financing, and public financial management for health. Previously, Karishma worked as an economist in the Burundi Ministry of Health under the DFID-funded ODI Fellowship Program. Karishma, thank you for joining us today and welcome. As I mentioned earlier in the webinar, the HFG project has recently developed a guide to help countries choose the appropriate health expenditure tracking tool based on their needs and priorities. Could you tell us a little bit more about this guide and how it's used?
Sure, thanks, Shipra. So HFG, through its technical assistance, observed that countries didn't always have enough information to make an informed choice about which expenditure tracking tool to use. Sometimes a tool was used by default because that's what had been used in the past, or sometimes the source of financing might have determined which tool to use. And so this led to, we saw instances of data being produced, but not always meeting the needs of the country, and therefore the data wasn't being used to their full potential. Sometimes this also led to multiple tools being used at the same time, leading to some duplicative data collection and also having different figures from different tools that could cause confusion. And so as we saw today, there are many expenditure tracking tools available, and their similarities and differences may not always be obvious. So we wanted to produce a guide that would help to empower countries to make informed decisions about which tool is really right for them. And we wanted to do this by equipping countries with the information about these different tools. So the guide that we've produced provides an introduction to the 5 tools that you mentioned earlier. It explains their scope and also the different policy issues that each tool is trying to address. Sometimes several tools might help to answer the same question, but each tool also helps to answer some unique questions as well. And we also realized, as we've heard today, that practical considerations also come into play when deciding on the best tool. So in the guide, we've also compared the tools based on what it takes to actually implement them. So for example, what does each tool require in terms of resources? How long do they take to implement on average? And what is the level of technical capacity that's needed to implement each tool? In terms of how to use this guide, the process really starts in country with a discussion about the priority health financing issues that the country is grappling with. So these issues are typically already known in the sector, but it's important to get consensus on these issues and prioritize which ones need to be analyzed in more detail. So once the priority issues are agreed on, then stakeholders can discuss what type of analysis is needed to provide more information on these issues. And when we mean health financing issues, we mean, for example, understanding financial sustainability. So for example, how much do domestic and international organizations contribute to health? So this would require a tool that captures total health spending in order to be able to compare different sources of spending. Or another issue might be equity. So what is the burden of spending on households? Where are households spending for health and what are they spending on? So this might require a different tool. Alternatively, another issue might be a country might be interested in a particular source of spending, for example, the efficiency of government spending, or a particular priority disease. For example, a country might want to understand the financing landscape for HIV/AIDS. So again, this would call for a specific tool as well. As I mentioned, though, we also have to be realistic. So it's important to understand the environment in which the country is working. So the next step is really to identify the different resources available, financial resources, human resources, and also time. Are there any timing constraints? It's important for the country to also discuss what data is available, what level of detail of data there is, and what is the quality of that data, because that will also influence which tool might be best. So all these factors also have to be considered. And then once the country is clear on their issues and also the resources they have available, they can use the guide to compare the different tools and then see which tool fits with the priority issues that they've identified.
Thanks, Karishma. The guide sounds like a really great resource. Could you talk a little bit more maybe about the lessons learned by HFG from the project's extensive work in resource tracking?
Yeah, so I guess I think we can all agree that the ultimate objective of doing expenditure expenditure tracking is to help make better decisions about health financing and for it to really lead to action. And we've seen that countries' health expenditure data is used the most or has the most impact when that data meets the country's needs. This sounds really obvious, but I think often there's an implicit assumption that just because data is produced and available that it will get used. But that's not always the case. So it's really important that the tool that's chosen will really help to answer the issues that decision makers are grappling with. So that would be the first lesson, that the driving factor is really what information are we trying to get and what policy question are we trying to answer. The second lesson is that we've seen that when countries make an informed choice about the expenditure tool to use, and when they know or they are clear about what questions they're trying to answer, this really helps to establish credibility, and that also helps when negotiating funding in order to support the health expenditure tracking exercise. Lastly, the tools that we've presented in the guide, they provide really valuable information on their own. So by tracking health spending, these tools help countries to understand the health financing landscape for the entire health sector or also for specific health priorities. The tools provide an insight on whether health spending is sufficient and also efficiency and equity of that spending. However, we've learned that the value of these tools and of spending data is really maximized when they're combined with other pieces of data. So, for example, combining spending data with costing information can be really useful to understand financing gaps, or combining spending data with health outputs can help countries to understand what's been achieved with the resources available and can help highlight potential efficiency issues.
Thanks, Karishma, for sharing with us some information about the guide and also your summary insights that HFG has learned from its resource tracking work in 23 countries. We're now going to go back to our second country panelist, Dr. Gemini Mtei from Tanzania. So I hope that the experiences of our panelists from Namibia and Tanzania, as well as our global experience of HFG, has been informative for our audience, and we hope that it'll help you as you consider tracking health expenditure in your country. As we mentioned, later on we'll share with you through the chat the link to the guide and other helpful resources will be available in this presentation. We'd now like to open the floor for the audience to ask questions of the panelists. Just a reminder to submit your questions in the Q&A window and to indicate if your question is for a particular panelist. And don't forget to provide your name and affiliation when you submit your question. So I think we'll start with a question for our panelist from Namibia. Thomas, could you please talk in a little bit more detail about the NASA and the health accounts being housed in different directorates and how you brought these two directorates to work together?
The NASA is housed in the Directorate of Special Programs, and while the Health Accounts is hosted in the Directorate of Policy Planning and Human Resource Development. Now, we as a country then sat around the table and looked at undertaking resource tracking exercise. And one of the questions we asked ourselves is the human resource or the resource availability. One, resource availability looking in terms of human resources within the two directorates. Do we have that capacity to do different exercises at different times? Two, financial availability to do particularly the costly exercise of data collection. And with those particularly two major constraints, we said that we rather have one technical team which does resource tracking, and the Directorate of Policy Planning and Human Resource Development then took over the leadership role of coordination. This is also formally part of our coordination role of the health sector itself, not only for a specific disease. And it really helps that we have a team working together and taking into account one methodology, which at the end of the day gives results which are credible and which is to the country's best interest. I thank you.
Thanks, Thomas. I think we can move on to another question. We have a question for Gemini from Tanzania. Gemini, it sounds like your government values the results from the public expenditure review that can be produced pretty quickly in time for budgeting and planning. Do they also see the need for data on private and donor expenditure in addition to the data on government spending?
Yeah, thank you, Shipra. Definitely, that is a very important data that we need to have. And, okay, so the way the financing system in Tanzania is, within the government system, we also have donor financing. So there's a donor financing that goes through the Ministry of Finance for budget support. But that is not a complete story. So we need also to get the information on donor funding that goes to vertical programs and the household. And the reason for this is it really helps to help in prioritization within the government itself. If we know, like the vertical programs through direct donor support are aligned to specific area and for specific interventions, then the central budget money can better be allocated to other areas that are really underserved. But at the same time, it's important to have this complete information to inform the national financing policy reforms. Like for Tanzania, we still have high dependence on out-of-pocket payments. It's about 20%. And the health insurance coverage is very minimal. So this information is very crucial so that the government can also look on how we are formulating the policies to protect the poor households against the out-of-pocket payments, but also motivating the prepayment systems. So the national health accounts information that cover all donors and private financing and government is very crucial. Thank you.
Thanks, Gemini, for shedding some light on that. We now have a question for our HFG expert, Karishma. Karishma, could you talk a little bit more about which country stakeholders should be in on the conversation about choosing the right expenditure tracking tool?
Thanks. That's a really good question. I should probably start by saying that the guide that we developed is intended for chief planners and senior policy officials who will make the final decision about which expenditure tracking tool to implement. But technical teams who produce expenditure tracking data can also find this guide useful because we've shared some resources to use when implementing each of these tools. But back to your question, the decision about who should be involved, we think this is really the result of a discussion between senior policy officials and the technical teams in the country. The decision makers will be the ones who really know what the issues are or what are the questions that they are trying to answer. And they will be the ultimate users of that data. So it's important for them to identify or be able to clearly express the information that they need. On the other hand, the technical teams, they will know the tools and they can help identify what type of analysis is needed in order to answer the questions of the decision makers. So it's really a two-way discussion between those two groups, and that's a discussion that should be throughout the process, from identifying those policy issues all the way to producing, validating, and disseminating the information.
Okay. Thanks, Karishma. That's really helpful, I think, hopefully for our audience as they listen to all of you talk in a little bit more detail and think about which tools make sense in the context of their country. We have another question from Christine Ortiz, for both Thomas and Gemini. Maybe Thomas, if you don't mind answering first. How did you overcome the specific challenges of technical capacity and data availability? Any suggestions for us on how to approach similar challenges? Thomas, would you mind answering first?
It's on technical capacity and?
And data availability.
Okay, good. With regard to technical capacity, the first thing which we have done is getting a working group within country who will be able to lead the resource tracking exercises. Then, with the assistance of WHO and HFG, we provided for training, firstly in understanding what resource tracking is all about, as well as when we are doing analysis, is to include the working group members in understanding the HUG tool, the analysis thereof, as well as understanding the mapping and classification. With regard to data collection, this is very critical. In our formation years, we developed a questionnaire which have standard questions to be posed to respondents. And this was done through enumerators. However, the issue of the communication from enumerator to respondents had become problematic, that you are not getting the quality data which you would require. Therefore, which we reverted to, that we call in our respondents, categorizing them by development partner, CSO, and having a working session with those specific groups in understanding the data collection tool, so that they will be able to provide us with valid information through electronic format. The other important thing is really to look at sampling of your respondents, particularly your development partners, who are the main role players, as well as your civil society or NGOs, and to doing the triangulation of the specific data. I thank you.
Thanks, Thomas. Gemini, do you have any suggestions for how other countries could approach the challenges of technical capacity and data availability?
Yeah, okay. I'll give the specific example for Tanzania. At least, for, as I said, we have already started this research tracking module at the universities. So the Ministry of Health at the moment is using some of the external expertise. So it's not only the ministry now doing the national health accounts, for example. It is engaging the external support through the academic universities. So that's one of the options to do that. But also, the other thing, or the other interventions that are currently ongoing, is institutionalizing the way the data is collected within the government systems. So there have been a couple of improvements within the planning systems, the electronic systems that are being used, at least to be able to fragment the information that is coming out of those systems, so that immediately that data can easily be processed within the Ministry of Health team without taking too much time to do it. So those are the few interventions that may be done.
Thanks, Gemini.
Yeah.
So we can move on to another question from Bob Fryatt. Bob remarks that this is a very interesting presentation. Thank you, Bob. And his question is, from the perspective of Namibian and Tanzanian policymakers, how often should these national tracking surveys be done? So this is a question for either Thomas or Gemini. Thomas, would you like to comment?
From our perspective, it is really good that we have it on a yearly basis, that we as countries produce up-to-date data on a yearly basis, that we do not rely on international respondents, and then at the end of the day, when we go to meetings, international meetings, the World Health Assembly, and disown information. So it should be more country-led, that we have that process.
Thanks, Thomas. Gemini, would you like to respond?
So in Tanzania also, From 2010, we are doing the National Health Accounts yearly. And the public expenditure is also being done yearly. The only difference is the timing. The PER is usually coming up earlier compared to the National Health Accounts, which takes time to collect data. For the NASA, it's still not consistent. Like for now, we have the for 2013-14, while we are currently finalizing the National Health Accounts for 2015-16. So it's not like a consistent to be done for the National Health Account, for the NASA, sorry.
Thanks, Gemini. Karishma, would you like to add anything?
Yeah, I just wanted to share that the guide that I mentioned, we've done a comparison of the 5 tools that you saw today, and we've tried to analyze what is the recommended frequency or best practice frequency for each tool, and also on average how long each tool takes to complete. So that might be useful as well for participants. The other thing to add is that I think just the frequency of these tools, as Gemini mentioned, really depends on the data systems available in the country. So the more that routine data collection systems can be used to collect expenditure data, the faster you can produce or you can apply each tool, and therefore the more regularly it might be possible. But I think the availability of data really has a big impact on kind of how frequently those tools can be applied.
Great, thanks, Karishma. I think we have time for one more question. I see here a question for Thomas from Namibia. Could you tell us a little bit, Thomas, about how you adapted the data collection tools to collect data for both the health accounts and the National Aid Spending Assessment?
Okay. What we have done with regard to the data collection for aid spending is particularly when you go into the in what disease was the money spent on. Because once you indicate that it's for HIV/AIDS, we then going to try and get the subcategories or expenditure categories for HIV/AIDS and try and allocate all that funding in those possible categories. So that's particularly the main area where we had made great adaptation. And then also obviously to add an additional questions which are looking to get data on non-health expenditures, particularly for example, your OVC expenditures.
Thanks, Thomas. And thanks to our audience. Your questions have been very thoughtful and insightful and hopefully useful to everyone. It looks like we're out of time, so unfortunately we won't be able to take any more questions. But before we end, we just wanted to share with you some resources that you might like to check out. Alina will also be sending you this link for the guide that Karishma has been telling you about. And please note that this guide that you're getting the link for actually has within it links to the 5 tools that we talked about today. So if you follow the link to the guide, you'll also be able to access the different tools from within the guide. Also, as I mentioned earlier, this was the second of a series of 3 webinars that we're hosting around health expenditure tracking. So please stay tuned for the final webinar that we'll be conducting as part of this series, which will look into how countries can streamline the data collection and production process for resource tracking exercises. We'll be in touch with you once the date is scheduled. I hope you found this webinar to be engaging and informative. I want to thank our 3 panelists for joining us today and for sharing their wealth of experience. And I also want to thank you, our audience, for tuning in and being so engaged. On a last note, once you close the webinar window, a survey will pop up in your browser. If you don't mind taking a moment to complete the survey, it'll help inform our next webinar. Thanks and goodbye.